It's being called a game changer in the fight against a common complication of childbirth. The U.S. Food and Drug Administration has approved the first pill designed to treat postpartum depression. CTV's medical expert, Dr. Marla Shapiro, is joining me now with more. Good morning, Dr. Marla. So glad that we are having this conversation today. Let's begin by talking about postpartum depression. What is it? How common is it?
It's much more common than people are aware of. When you look at what the stats are for postpartum depression, it can affect 1 in 7 pregnancies. So those are really large numbers when you look at that. And when we look at what the cause is, we believe that it's related to a hormone called pregnenolone, which comes from a hormone that most people do know, progesterone. It rises during pregnancy quite rapidly, and then it can catapult postpartum. And this pill is targeting pregnenolone, which is, we believe, the root cause to postpartum depression. When we look at the incidence of this in terms of maternal death, 20% of maternal deaths are related to suicide that come from postpartum depression. So this is really, a potentially life-threatening condition. Women experience sensations of guilt and worthlessness, the type of things that we do see in a regular depression, but often they can't bond with their babies. And it really is a very significant illness that really needs rapid attention and treatment.
1 in 7, wow. Okay, so there are other postpartum treatments out there, but this is different.
Yeah.
You kind of touched on that. Tell us more about what makes this pill and the way it's taken different.
So it's really quite interesting because there was 2 medications that have been approved. One is an intravenous use. So that's difficult to access, and you have to be able to get to a medical center and be able to get the infusion. This is an oral medication, typically taken over a 2-week period of time. And they saw significant improvements in terms of moms' moods and the impact on their depression compared to a placebo. And it lasted for a long period of time. But what was also so important was the speed of the action in terms of improving mood. So that's really critical here as well.
So can you take it for another course, or is it just 14 days?
So it's an interesting question. I think that those are questions that we don't necessarily have the answers to right now. It was studied mostly in women who had severe clinical depressions. So we don't know whether or not it will work in mild to moderate depression. But it's so important because, firstly, it's also raising the conversation about postpartum depression, how critical it is to be identified and have speed of treatment. And the fact that this works so quickly in the form of a pill that can be taken is really very important. We tell women when they're on this to make sure that they're using some form of contraception because we don't know how it could impact a fetus, but typically these are not women who are going to be pregnant. They're immediately in that postpartum period.
What are medical health experts saying about this? How are they reacting?
So, firstly, to have an alert about the common side effects, things like drowsiness, don't operate heavy machinery, the fact that any type of depression when it's first treated can actually increase the risk of suicide. So these women do have to be looked at as they begin to feel better. They actually feel that maybe this is something that they can do. It's a side effect that we see with almost any antidepressant. That kind of alarm is there, runny noses, that type of thing. I think the alarm out here is that it's been studied with significant depression. It doesn't replace the importance of psychotherapy and talking, but it really does highlight the fact that this is a brand new medication that works completely different, targeting the hormones that we believe are related to postpartum depression, and works so quickly. So, if you're a mom in that postpartum period of time who's having feelings of worthlessness, I can't be a mom, don't bond with the baby, really important to speak out and get the care that you need.
And last question, just quickly, do doctors know yet if you can breastfeed while you're taking this
so
medication?
it's a good question as well. These are things that typically these moms don't want to breastfeed because they don't feel connected to their babies. So typically, I think at the present time, that's something that we would not recommend. We're focusing on the mom and the wellness of the mom. So, moms can pump, and then when they're done their medication, can reassess the importance of breastfeeding, which is important for maternal bonding. But really, this is a game changer in terms of what can be a life and death diagnosis.
Dr. Marla, thank you so much. Again, really important conversation. Appreciate it.